Chikungunya virus is transmitted to people by mosquitoes. The most common symptoms of chikungunya virus infection are fever and joint pain. Other symptoms may include headache, muscle pain, joint swelling, or rash. Outbreaks have occurred in countries in Africa, Asia, Europe, and the Indian and Pacific Oceans. In late 2013, chikungunya virus was found for the first time in the Americas on islands in the Caribbean. There is a risk that the virus will be imported to new areas by infected travelers. There is no vaccine to prevent or medicine to treat chikungunya virus infection. Travelers can protect themselves by preventing mosquito bites. When traveling to countries with chikungunya virus, use insect repellent, wear long sleeves and pants, and stay in places with air conditioning or that use window and door screens. Prevention. No vaccine exists to prevent chikungunya virus infection or disease. Prevent chikungunya virus infection by avoiding mosquito bites. The mosquitoes that spread the chikungunya virus bite mostly during the daytime. Protect yourself from mosquito bites. Use air conditioning or window/door screens to keep mosquitoes outside. If you are not able to protect yourself from mosquitoes inside your home or hotel, sleep under a mosquito bed net. Help reduce the number of mosquitoes outside your home or hotel room by emptying standing water from containers such as flower pots or buckets. When weather permits, wear long-sleeved shirts and long pants. Use insect repellents. Repellents containing DEET, picaridin, IR3535, and oil of lemon eucalyptus and parmethane products provide long-lasting protection. If you use both sunscreen and insect repellent, apply the sunscreen first and then the repellent. Do not spray repellent on the skin under your clothing. Treat clothing with permethrin or purchase permethrin-treated clothing. Always follow the label instructions when using insect repellent or sunscreen. More information about insect repellents can be found on the CDC West Nile virus website, Insect Repellent Use and Safety. 2 images. One of a man placing a screen on a window and the other of a woman applying insect repellent to her legs. If you have chikungunya, follow these instructions. During the first week of infection, chikungunya virus can be found in the blood and passed from an infected person to another mosquito through mosquito bites. An infected mosquito can then transmit the virus to other people. To prevent further spread of the virus, it is important for people to avoid mosquito bites during the first week of illness. Transmission through mosquito bites. Chikungunya virus is transmitted to people through mosquito bites. Mosquitoes become infected when they feed on a person already infected with the virus. Infected mosquitoes can then spread the virus to other people through bites. Chikungunya virus is most often spread to people by Aedes aegypti and Aedes albopictus mosquitoes. These are the same mosquitoes that transmit dengue virus. They bite mostly during the daytime. Aedes aegypti on the left and Aedes albopictus on the right. Aedes mosquitoes transmit chikungunya virus to people. These types of mosquitoes are found throughout much of the world. Rarely, from mother to child. Chikungunya virus is transmitted rarely from mother to newborn around the time of birth. To date, no infants have been found to be infected with chikungunya virus through breastfeeding. Because of the benefits of breastfeeding, mothers are encouraged to breastfeed even in areas where chikungunya virus is circulating. Rarely, through infected blood. In theory, the virus could be spread through a blood transfusion. To date, there are no known reports of this happening. Symptoms, diagnosis, and treatment. Symptoms. Most people infected with chikungunya virus will develop some symptoms. Symptoms usually begin 3-7 days after being bitten by an infected mosquito. The most common symptoms are fever and joint pain. Other symptoms may include headache, muscle pain, joint swelling, or rash. Chikungunya disease does not often result in death, but the symptoms can be severe and disabling. Most patients feel better within a week. In some people, the joint pain may persist for months. People at risk for more severe disease include newborns infected around the time of birth, older adults, greater than or equal to 65 years, and people with medical conditions such as high blood pressure, diabetes, or heart disease. Once a person has been infected, he or she is likely to be protected from future infections. Diagnosis. The symptoms of chikungunya are similar to those of dengue, another disease spread by mosquitoes. See your doctor if you develop the symptoms described above. If you have recently traveled, tell your doctor. Your doctor may order blood tests to look for chikungunya or other similar diseases. Treatment. There is no medicine to treat chikungunya virus infection or disease. Decrease the symptoms. Get plenty of rest. Drink fluids to prevent dehydration. Take medicines, such as ibuprofen, naproxen, acetaminophen, or paracetamol, to relieve fever and pain. Geographic distribution. Where has chikungunya virus been found? Prior to 2013, chikungunya virus outbreaks had been identified in countries in Africa, Asia, Europe, and the Indian and Pacific Oceans. In late 2013, the first local transmission of chikungunya virus in the Americas was identified in Caribbean countries and territories. Local transmission means that mosquitoes in the area have been infected with the virus and are spreading it to people. Since then, local transmission has been identified in 45 countries or territories throughout the Americas, with more than 1.7 million suspected cases reported to the Pan American Health Organization from affected areas. Updated data from PAHO.